Hey, it's Dr. Lin with Empowerment Physical Therapy, and today we're going to talk about whether it makes sense to wear a knee brace if you have knee pain. This episode came out of the context while working with one of our clients who came in with a knee pain, and that was a result of a contusion that she had while she was helping a friend moved. So she had some swelling. She saw the doctor, and her doctor, who is an orthopedic, drained the fluid that was out of her knee. So that significantly helped and gave her a lot of comfort, but it wasn't resolved. At the same time, she was given a knee brace, one of those bulky knee brace. And she and I had that conversation during our examination. She asked me if it makes sense for her to wear that bulky knee brace that her physician had given her. And I said, is it helping? Is the knee brace helping you? And she said, not really. Honestly, not really. Because she was logging around the knee brace and it changed the way she was walking. It was giving her more problem and trouble than it solved. Common sense says that if it gives you more trouble than it solves, then I think it makes sense for her to kind of not have that knee brace and see how it feels, because she was getting more support than she actually need. So what I suggested was to have her walk without the brace. And guess what happened? When she came in the following session, she felt better, simply because she didn't have an extra support, an extra weight to log around that changed the way she was walking. It really changed her gait. And anytime you change your walking pattern, it goes up the kinetic chain from the ankle, the knee, the hip, and sometimes the back. Because of how we'll call it a ripple and a domino effect. Your walking pattern, it's a smooth and rhythmical walking pattern that you should have. So what we gave her instead was have her try a sleeve, a knee sleeve. That is that's a little more dynamic. That's the first thing that I love. It's because you can move in those, and there's less restriction. There's a lot more freedom of movement when you have a sleeve as opposed to a brace. Now, there is a time. Don't get me wrong. There's a time in a knee for a brace. Let's say after a surgical intervention, or if you had surgery, or if you had a fracture in a knee stability, and you need to have that sort of support and structure, then it makes sense to have a knee brace and walk around with that to protect that fracture, to protect what was done with the surgery. But for someone who kind of just had a knee contusion, which created swelling in her knee, it didn't make sense to wear a bulky knee brace and carry that around, because it's going to do more harm than good. So I think the takeaway from this episode and this story is to kind of look at something that you're going to use, any sort of support that you're going to get, to make sure that it doesn't cause more problem than it solves. And if it does cause more problem than it actually solves, get rid of it for a couple of days and see how it feels. I hope that helps. If you enjoyed our videos, please subscribe and toggle a notification so you can follow us for updates.